Our next speaker will talk to us about what to expect from a fellowship from minimally invasive surgery. So Dr. Pryor, please come on up. Dr. Pryor is a MIS bariatric surgeon, a professor of surgery and chair of the Division of General Surgery from Stony Brook, New York. She's also a SAGES leader and was a program chair of the recent meeting at SAGES last month. And she's also treasurer of the Fellowship Council, so she'll be giving us some insight into what it's like to be an MIS surgeon. Please go ahead.
Great. Thank you so much for the invitation. All right. So SAGE's sponsored fellowship's a little more broad than I think some of the other categories we've heard. There's kind of a variety of broad areas in GI surgery that any of these fellowships can cover. Maybe foregut, it could be flexible endoscopy, bariatric. Actually, Stacy might comment on this later, a lot of the bariatric fellowships are actually losing volume that is required for bariatrics because of this change from stapled cases like the Roux-en-Y gastric bypass to sleeve gastrectomy. So some of those are back and falling as SAGES fellowships with the MIS NOMER. Abdominal wall cases, endocrine, and really, since there's so much variety, these are really the most common of the Fellowship Council fellowships. So what does it mean to be that type of surgeon? Really, any GI surgeon who does any kind of advanced techniques is considered a minimally invasive surgeon. And we're actually shifting some of the nominating and the name approaches of the MIS fellowships, and it's really becoming more general surgery in any variety. You need to be fluent in a variety of approaches, minimally invasive. We think you should be able to do endoscopy, but really most of the surgeons in this area will pick a specialty practice. So I'm a foregut and bariatric surgeon. I do occasional other cases, but really that's the big focus. You'll have endocrine surgeons that are MIS fellowship trained. You'll have colon and rectal surgeons who are not GME trained colorectal, but you'll definitely have people who do an MIS fellowship who do a variety of colon, solid organ surgeons, but we don't usually do all those things in a practice. So you're going to find people who train with an MIS fellowship who have a variety of practices, but most people pick one area. So what are the steps for applying for these fellowships? And I think you've heard this from the other program directors. Network. Meet people who are doing things that you're interested in. Meet them through the societies. Meet them through your mentors at your program. And choose a fellowship that's going to be either focused if you know exactly what you want to do, or broad so that you can go out and become what you want to become, and if you don't know it yet. And I think particularly now that we're applying as fourth-year residents, a broader fellowship may be very helpful for you. You then have opportunity to become an HPB surgeon or a foregut surgeon or a hernia surgeon based on where you end up practicing and what the opportunity is. And I think that's what MIS fellowship helps get you, is it gets you that extra training but doesn't define you early on. When you look at the Fellowship Council website, when you're deciding on fellowship, I think it's really, really critical, since our accreditation doesn't say that this is a foregut fellowship or a hernia fellowship. You need to look through the specific program case logs so you can really see what that fellow actually will do at that program. And talk to the old fellowships once you actually get there and are in the interview process. Talk to the fellows, find out what their practices are like, so that you can really have an idea what that fellowship will really train you for. Like everybody else said, have a good solid background from your residency, have good clinical experience, get great recommendations. If I know somebody that you've been training with and they call me up and say, this is the best person ever, that gets you an interview at my program. If I don't know where you trained, you still might be able to network and still get a good letter from somebody or still get a good phone call, but I think that helps get you that interview spot. In our program, we do want to try to help people get an academic career started, so I do think having some research experience is helpful, but it depends where you come from. If you come from a program that does 2 years of research and you get a couple publications, that means a lot less than if you didn't have research as an opportunity and you got a couple publications. So we look at it based on where you trained, not just what you did with it. And I do think your scores are one of the things that we use to get you that interview spot. But I definitely pick my fellow based on who I like in the interview, who I think I could work with, because you do become part of my family for the year that you're my fellow. What are the requirements for the MIS fellowships? It's 150 advanced cases. Up to 75 bariatric cases can count in that number. And although it's not completely specific, hernia can't be the majority of your cases. And this is something Rohan's nodding because we debate about this all the time. Flexible endoscopy is the other category of fellowships that is SAGES sponsored, and that requires 100 therapeutic, not diagnostic, endoscopic cases. And beyond that, there's not a whole lot of definition in these areas. There have been some discussions, and right now SAGES and SSAT are getting together and trying to further define some of these areas specifically for foregut surgery, so that may have some more definition in the future, but right now these are the two categories that we have. Fellow certification is offered by SAGES. We require that you've completed FLS, FUSE, and FES, since those are now all available options for certification. I think this is going to become a moot point as these things become required by the board, but they're not all required right now. Your program director does need to recommend you after your fellowship and think that you've done a good job and met the requirements of the fellowship. We also feel that you need to have been evaluated, and there's two different evaluation forms that are used during fellowship. Goals and gauges are standardized tools, and your fellowship program director is required to fill these out during your program training. We also ask that you've met all of the fellowship requirements, so we'll actually look at your specific case log to make sure that you've done the cases that you were supposed to. And one of those things is that you've had some academic productivity with an abstract submitted to and attendance at a national meeting. So your abstract could be lousy, but you just have to submit it. So what's the career like if you choose an MIS or Flex Endo fellowship? This, again, since it's a very varied fellowship, can be a very varied career. And I think most MIS surgeons have similar focus in some areas, but have a lot of variety in their practices. You can be any of these things depending on where you end up practicing and the opportunities provided. And your clinical focus really can be any area of GI surgery. Thank you.